Okay, so just a little intro here. So I am Kylie Rodrigues. I'm the benefit specialist for the consortium. I deal with any questions you have about premiums, claims, benefits, ancillary benefits, comparisons, provider issues, network issues, travel issues, and coverage. So feel free to call me anytime or email anytime. So that's what I do now. So in my previous life, I was a high cap coordinator, Medicare counselor for Office for the Aging for 8 years. So I lived and breathed Medicare every day, talked about Medicare every day, and loved it because I'm an insurance nerd, like most people don't believe me. So this is kind of what I talked about all the time, and I taught Medicare 101 classes as well. So if you have more questions that get into nitty-gritty details and you don't want to ask them here, you're welcome to email me and call me anytime. I love talking Medicare. It's a weird thing. Okay, so starting off, a lot of people confuse the terms Medicare Advantage and Medicare Supplement, and they are very different plans that have very different coverage. So I kind of wanted to just talk about how they work and the components of Medicare. So this chart is kind of what you go by. You can't have a Medicare Supplement plan with a Medicare Advantage plan or vice versa. You either choose one path or the other. You either stick with original Medicare and then you pick up all the components A, B, D, or you go to a Medicare Advantage plan, which is also called Part C. We'll get there why they messed up the alphabet, I promise. So in talking to our municipal members about why would we go with a supplement versus a Medicare Advantage plan, what are the differences, we'll dive into that component. I want you to keep this chart in mind for the rest of the presentation because it's important to understand you're not going to mix them up. The other thing to talk about for Medicare Advantage plans, which isn't as common on the main market, but we're looking at as a consortium, is whether we want a Medicare Advantage plan that houses Part A, B, and D, or do we want a Medicare Advantage plan that only houses A and B, which is medical, and then have a separate Part D or egg whip, don't ask me what it stands for, Elin can tell you, that provides the drug coverage separately. And there are pros and cons to why we would look at it that way, which we'll get into when we start talking about that stuff, but just something to keep in mind. So when and I know that some people in this room have heard this lecture before, when we talk insurance, I want to make sure we're all on the same level. We all understand the same terms and what they mean before we start diving into what benefits are for those plans. I know most of you know this, but I'm going to go over it anyway because it takes about 30 seconds. So deductible, it's the amount of money you have to pay out of your pocket before a benefit starts having coverage. So perhaps you're on a gold plan and you have to pay a $1,500 deductible, and then the coverage will kick in and cover at 80% and you pay a 20% coinsurance. But you have to meet that deductible first. Out-of-pocket maximum. This is the maximum out of pocket that you pay, and once you meet it, you're covered at 100%. I will tell you that original Medicare does not have an out-of-pocket maximum. The bills just keep coming. So that's why most people look at either a Medicare Supplement plan to supplement original Medicare or a Medicare Advantage plan that has a maximum out of pocket. Coinsurance. So coinsurance is the percentage you pay for a service. So let's say you go to the doctor, I have my gold plan, I met my deductible, I'm going to pay 20% for that visit, the insurance will pay 80%. Versus a copay, which is similar to our platinum plans. A copay is a set dollar amount you're going to pay for that service. I pay my $15 when I go to the doctor. The rest is covered by insurance. So parts of Medicare, not very many people know what the different parts of Medicare are, and you don't automatically get all of them. So Part A is typically no premium. It's based on your work experience. You have to have 40 work credits, which equates to about 10 full-time years of work. Part A, then you're enrolled once you turn 65, or you can be deemed into Medicare after 24 years or 24 months on Social Security disability. Most of our members age in. So after you age in and you're enrolled in Part A, A lot of people think, cool, I have my hospital coverage, I'm all set. Part A does not cover hospitals at 100%. So you pay $1,556 in a deductible, which renews every 60 days you're out of the hospital. So you can actually be hit with this multiple times throughout the year if you keep having to go back into the hospital every couple of months. And then there are, of course, other fees. If you stay in the hospital longer than 60 days, then you have a per day copay rate of $389. And then there's other lifetime reserve days, which I'm going to be honest with you, in 8 years of Medicare counseling, I saw one person who ever hit their lifetime reserve days. Hospitals don't want to keep you. They want to send you home. They don't want to keep you for 91 days in a row. The other thing is let's say you're hospitalized under original Medicare and they send you home within 2 days and you're still not feeling well and you go back in. Well, you were sent home on day 2, so you go back in on day 3. You don't get recharged the $1,500. You're still within that 60 days of being in the hospital. So Part B, this is the part you pay for. So this is the part that comes typically out of your Social Security if you're collecting Social Security at the time. And this year's premium is $170.10 coming out of your Social Security. If you're not collecting Social Security, don't worry, they track you down and bill you. They bill you quarterly for this premium amount. So I have seen it where some people opt out of Part B. You don't want to do that if you're retired, because then you face late enrollment penalties later on. I'm not going to get into that, but you're welcome to call me if you're in that situation. So basically a thing to keep in mind for either one of the plans, the Medicare Advantage or the Medicare Supplement, you have to have Part A and Part B in order to even enroll in the Medicare Advantage or Medicare Supplement. If you don't have both, you can't pick up the other plan. The other part of Part B is it does have an annual deductible. So you have to meet that $233 before Part B will cover a doctor's visit at 80%. So another expense there as well. So you're looking at a 20% coinsurance every time you go to the doctor on original Medicare, or every time that you have an outpatient surgery or an ER visit or an urgent care visit. Part B is what covers all your outpatient care. It also covers your durable medical equipment and supplies. Most preventative services are covered at 100% of Part B, not subject to that deductible, but it depends on the service and how it's billed. So we're going to skip Part C for a minute. I know I'm going all out of whack with the alphabet, but that's how Medicare did it, I promise. So Part D. Part D is your drug coverage. Now, the drug coverage varies depending on the plan. These are averages when it comes to Part D standalone plans within the Medicare system right now. So right now, the maximum deductible is $480. So once that's met, then your coverage kicks in. Most drug plans that have a deductible at least cover tier 1 and 2 medications without having to meet the deductible. But they also have up to 5 tiers, whereas right now we have 3-tier drug formulary. So we would have to look at those differences. The average Part D premium is $33 per month. I'm not saying that's the best plan. I'm telling you that's the average. Of course, the more money you spend on insurance, typically the higher the coverage goes. So I'm not sure who's heard of the donut hole or coverage gap. If you have a senior in your life, I'm sure you've heard them complain about the donut hole. I'm going to overview it as of today. So we did sit in on a webinar. Some of this information is not going to be up to date as of next month when the legislation gets passed. So of course we may be presenting updated information as we go later into this year, but as of today, this is how it stands. So with the donut hole, typically you and the insurance combined spend $4,430 on medications, and then you fall into what's called the donut hole. And then the beneficiary would be paying 25% for their drugs, be it generic or be it name brand. So a lot of people who are on name brand medications, let's say name brand insulin or inhalers, see a huge increase in their copay rates for their medications. There are ways to avoid that when it comes to selecting plans for the consortium, such as wraparounds and other benefits, but we'll discuss that as we dive into the RFQs that were submitted. Once you reach another dollar amount, which equates to roughly $2,500 out of the beneficiary's pocket, you reach what's called catastrophic coverage. And when you reach that, your copays drop way down, and that's for the remainder of the year. To be honest with you, most people can't afford to get to catastrophic because they have to spend so much money out of their own pocket to get there. And of course, this whole cycle of Part Ds and donut holes and deductibles starts every January. So this briefly explains what, I always like visuals when I'm talking about coverage gaps and donut holes and what are we talking here for money. So this is a nice visual to look at to see where that money is coming from. So when you start out an initial coverage, really your insurance is helping to pay for those extra expenses with the medications, and you're paying your copay rate or your percentage. But once you fall into the donut hole, you see that a lot of generic would be funded by the plan, but there's also, it falls back on the drug manufacturer. Those are negotiated things that Medicare has done, which is now changing again. But it's something to look at of where that cost and coverage is coming from in the future. And then of course, catastrophic period is where you pay that very small amount as the beneficiary. The plan pays a small amount, and then the rest is subsidized by CMS. Before I dive into Medicare Advantage, does anyone have questions about original Medicare, Part A, Part B, or Part D, which is the drug coverage? I'm not hearing any, so I'm just going to scoot on ahead. Okay, so Part C, sorry I did the alphabet out of order, are Medicare Advantage plans. So Medicare Advantage plans, like I said, can include A, hospital, B, doctor, D, drug coverage, all in one card. But they don't supplement original Medicare, they replace your original Medicare. So the only person who's paying for any of your claims is the Medicare Advantage plan. Medicare is not going to then come in as secondary and pick up the rest. That's not how it works. Medicare Advantage plans have set copays or coinsurances for services, and they can vary from year to year depending on the plan, just like the premiums can. Medicare Advantage plans are more subject to networks as well. So making sure that you're going to in-network normally results in a lower out-of-pocket cost to the beneficiary than going out of network. Now, when it comes to plans like we're looking at, you could look at having the same in and out of network benefits. All of that's negotiable. But when it comes to straight on the market Medicare that people are selecting, they don't have those options. One of the things when it comes to Medicare Advantage plans is they have to match the original Medicare benefits or do better. And there's certain mandates that come down from Medicare saying you have to offer these ancillary benefits because this is what people are looking for. And then Medicare Advantage plans actually get a portion of the Part B funding to help them offer their plans to people, and it decreases the administrative costs for original Medicare. So original Medicare wants you on a Medicare Advantage because then they don't have to do most of the claims data work. Something to keep in mind, even though Medicare Advantage plan replaces original Medicare, you still have to pay that Part B premium. Otherwise, you won't have A and B to be eligible for the plan. Other things is living in the service area. Plans can vary from county to county. When you're on the general open enrollment for Medicare, the plans that are available in Tompkins County aren't the same plans that are available in Steuben or Schuyler or Onondaga or Seneca. So you really have to make sure where your providers are to make sure you're staying in that network. Let's see here, covered some of this already. The fixed copay rates, this was one of the examples that I actually took from an fully insured open market Medicare Advantage, but like a $250 copay per day for the first 5 days you're in the hospital is an example of how that's their Medicare Advantage hospital coverage versus original Medicare, which would be the $1,556 for your stay. So trying to see where you're getting the better benefit or the smaller out of pocket. Medicare Advantage plans have maximum out of pockets. So if you have something catastrophic happen, you know, okay, I'm only going to have to reach my 6,000 and then I'll have 100% coverage for the rest of the year. Or I'm only going to have to reach my 10,000, I'll have 100% coverage for the rest of the year. Original Medicare never has that. You will never cap out on original Medicare. You will just keep accruing bills. Medicare Advantage plans also add on things like hearing, vision, dental. They have over-the-counter cards where you can go purchase vitamins and Band-Aids. A lot of them do meals for when you get home from the hospital. They do home delivered meals straight to your door. There's a lot of different extras that come with Medicare Advantage plans that are really a great advantage to people enrolled in them. Medicare Advantage plans can have the standard Part D drug coverage where it's subject to coverage gaps and catastrophic, but that can be avoided as well, depending on the plan. This is just, I like some of their charts a lot and I visit their website often. So I thought this would be interesting to just show the growth of Medicare Advantage plans over the course of the last 12 years to show what an uptick in enrollment has looked like. And I know in our general area, there's definitely a huge market where it comes to enrolling new providers, making sure that they have bigger hospitals and networks and things like that to be more competitive with one another. So there's definitely quite a few Medicare Advantage plan options. So how does Medicare Supplement work? Well, we do know we have to have Part A and we do know we have to have Part B to get a Medicare Supplement plan. But a Medicare Supplement plan is exactly what it says. It supplements original Medicare. It does not replace any of your original Medicare benefits. It just picks up those amounts that I was talking about, that $1,500 when you go to the hospital, that 20% when you go to the doctor. It's picking up those amounts and supplementing your coverage. Now, there are a wide variety of Medicare Supplement plans, but I'm mainly just going to talk about the ones we offer because ours are kind of the top of the line. And I'm not being sarcastic. They compare to a Plan F, which isn't even available to new Medicare eligible people. They discontinued it for anyone new on Medicare. But our plans pick up all of those balances. So essentially the person would, going to an in-network provider, see no medical bills. Medicare Supplement plans also are not as restricted for networks, depending on how the Medicare Advantage plan looks, because they follow a Medicare network. So as long as someone takes original Medicare, there's an automatic crossover of claims and the Medicare Supplement plan picks up the balance. So you could be anywhere in the United States that takes Medicare and you wouldn't have to worry about, are they in network with my Excelis Medicare Supplement plan? They do follow Medicare guidelines as well. So if something's not going to be covered by Medicare, it's not going to be covered by the Medicare Supplement plan. So this just has some tidbits about our Medicare Supplement plans. So it does pick up all balances after original Medicare, and we currently offer two plans, the MS3 and the MS4. The only difference between these two plans is their prescription copays. They have the exact same medical benefits. And we do have the benefit summary up on our website as well for your review, which is just a lot of covered in full. It's there. But just to compare, the MS3 does have lower copay rates for medications. There is no donut hole that applies to this plan. This is not a Part D drug coverage plan. This is a consortium drug plan. And we recently updated in January to include a 90-day supply at retail pharmacies for our Medicare Supplement plan. So you can get a 90-day fill at a retail pharmacy for 3 months worth of copays, or you can go mail order and get a 90-day supply for 2 months worth of copays. We also, at the consortium, there's riders that have been added to the medical benefits. And this is additional benefits that wasn't here for this, but the consortium decided would be an awesome benefit for retirees, and it really is, because hearing and vision are two benefits that are very difficult for any senior in any insurance to find coverage for. So these plans also include an exam, hearing aid coverage, routine eye exam, and a $100 eyeglass allowance. So I just did a quick, let's look at the big picture summary page kind of thing, Medicare Advantage versus Medicare Supplement. So Medicare Advantage typically has lower premiums, but they can vary from year to year, has set co-pays for most services. Out-of-network benefits depend, of course, on the contract, insurance carrier, and geographic location. ER visits are a national coverage. It's embedded, it's mandated by CMS. So anywhere in the United States that you go with a Medicare Advantage plan, you're gonna pay as if you were going in network for the ER. Prescription coverage may include a donut hole, sometimes they don't, depending on how you create those plans. But it also includes a lot of other advantages, hearing, vision, over-the-counter, home-delivered meals, a lot of things that pretty much every other insurance plan may not cover. Medicare supplement plans are typically a higher monthly premium. They are premiums that are set by the consortium. This isn't a fully insured plan. It's a plan that's the consortium created and controls. It picks up the balances after original Medicare. And as long as you're in network with original Medicare, the supplement plan will treat it as an in-network service and cover the remainder after original Medicare. Original Medicare actually has a really huge national network that travels very well, especially for retirees who want to move out of the area. Our prescription drug care plan with the Medicare supplement has no donut hole, has no catastrophic. You pay the same copays throughout the year. And it also includes hearing and vision benefits that are not standard to any Medicare supplement plan on the open market. And most of these pages are like old friends to me, but these are my references in case you wanted to take a look, go do your own research. There's lots of information available if you wanted to take a look and see what I saw. Does anyone have any questions about Medicare Advantage plans or Medicare supplement plans or how they work or what they cover?
I have one question.
Yeah.
So I know it's not contradictory, but it sounds like it at first. So when you say that in order to be eligible for the Medicare Advantage, you have to be on Medicare, A and B, which means you're paying the premium, the 170, right?
Yep.
But they're not going to cover anything.
Right. So the question was, I'll just repeat it in case they can't hear on Zoom. The question was that you have to pay for Part B, which is $170 a month, to be on a Medicare Advantage plan, but then original Medicare is not going to pay for anything. And that is accurate. So you have to pick up Part A and B in order to enroll in the Medicare Advantage plan, but then the Medicare Advantage plan replaces your coverage. The stickler point is the money value. So you have to pay your Part B so Medicare can turn around and pay a portion of it back to the Medicare Advantage plan. And that's how they make sure you pick that up and then pick up the plan.
Yeah, okay. That's what I thought. I just want to make sure I understood it was, you know.
Yep.
Okay, thank you.
Yep. I'm just gonna.
What is our rate through the consortium again for Medicare supplemental?
The MS4 is $635.05, and the MS3 is $728.38. Come on, Terry. Okay. 700 plus for the MS3.
Thank you.
Yeah, I can definitely get you those rates after too.
And Kylie, this presentation will also be available on our website, the same as Bob's was, because there's a lot of great information here.
Sure. Yeah, I can definitely post on our website. We were going to email it out after as well to anyone attending. Yeah.
Great. So Kylie, I just have a question.
Sure.
This is the first time I've seen this clarification. On our Medicare supplement, the employee does not need to have Part D, correct? So
Oh,
our supplement is in place of a Part D?
that is a great question. So our Medicare supplement provides drug coverage that is credible, so you do not need to pick up a
They don't
Part D
have the
plan.
A and B and pay the 170.
Yep.
And then our premium of they had MS4, so they got 635.05. So they would pay that as their total premium with no Part D. That's their premium.
Right.
Or
So-
however it works with the employer pays portion or whatever.
So Terry's question is, if they have, on our Medicare supplement plan, and they're enrolled in original Medicare and they have Part A and Part B, do they still need to pick up Part D? They do not. So our Medicare supplement plan covers equal to or better than Part D. It's considered credible drug coverage, and they do not need to pick up a Part D plan, which would be some cost savings to someone enrolling in Medicare.
One thing we did not mention is when you're on the Medicare supplement plan, you are eligible for retirement drug subsidy, which you can file for as the employer, not an individual. As the employer, you can file for a retirement drug subsidy. And Losi and Cahill are very helpful in helping you secure that rebate back. So Medicare Advantage are subsidized more upfront, whereas Medicare Supplement does have subsidy capabilities that, just like filing taxes, the employer would have to file to receive that subsidy. And Losi and Cahill have been doing a great support to our members in filing for that. And that won't be available with the Medicare Advantage plan.
Peter, do you got a question? Looks like you.
Yeah, kind of. I mean, so the drug subsidy that the employer can file for is that something that's obviously something that is being pushed out to them so they know it, right?
I think if they have questions about it, they should call Steve Losi and Cahill. It does